This is Dr. Saad in front of you, and today my topic is the polyps. So basically, what are polyps? Polyps are the small elevations or protrusions of mucosa. Clear? They are the small elevations or the protrusions of mucosa. Simply, this is your mucosa of any organ, and this is the small protrusion here. Now, these polyps, they may be sessile or they may be pedunculated. Now, what are this sessile and the pedunculated? Simply, for example, just take an example that this is your mucosa, any mucosa, maybe of intestine, maybe of gastric mucosa, maybe of endometrium. So, this is your mucosa and the polyp is just like this. This is your mucosal elevation. This is called as the sessile polyp. Sessile polyp, it means that this polyp having no stalk. There is no peduncle, no stalk. You can say it is directly adhered to the mucosa that are called as the sessile polyps. But pedunculated, as its name is indicating, that peduncle, that there is a stalk is present. Means now it is very simple. You can imagine by yourself. This is your intestinal mucosa or any mucosa, and this is your polyp. This is your peduncle and this is your polyp. Understand? So these are the sessile and the pedunculated polyps. Now basically the polyps, they can develop in many parts of our body. Like if they are if they are present in the stomach, they are called as the gastric polyps. If they are present in the intestine, they are called as the intestinal polyps. If they are present in the endometrium, so obviously they will be called as the endometrial polyps in the females. So they can be present in many parts of our body, but the most commonly these polyps, they are found in the intestine and mainly in the colon and the rectum. So that's why we will be studying in detail about the intestinal polyps. Clear? So they are, you can say, most commonly the polyps, they are found in the intestine, or you can say intestinal polyps are most common, and they are mainly found in the colon and the rectum. Clear? Now, first of all, I will be telling you the classification of the intestinal polyps in detail, and then we will be studying it one by one, every polyp, every intestinal polyp in detail. Clear? And basically one thing here to explain that all the polyps, basically they have their means origin is the inflammatory origin, mainly due to the inflammation they develop due to certain mutations. So their mainly the reason is the inflammation. Now I will be telling you in different polyps what are their mechanism or what are their causes. Now first of all, these are the polyps, and now I am writing here the intestinal polyps, because now we are going to study the intestinal polyps in detail. First of all, I will be telling you the classification of the intestinal polyps. So the intestinal polyps, they are broadly classified into two types. Number first is the non-neoplastic polyps, and the second one is very easy, the neoplastic polyp. Now everyone knows that what it means, non-neoplastic and neoplastic. Non-neoplastic polyp, it means that it has no malignant potential. Means the malignant potential, they cannot transfer into the, or they cannot be converted into the carcinoma. Means they cannot lead to the carcinoma. These are the non-neoplastic. While the neoplastic polyps, they have the malignant potential. Means it can lead to the development of carcinoma. Clear? Now first of all, I am telling you detail about the classification, then one by one we will be studying in detail every type. Now the neoplastic polyps, they are further divided into three types: 1, 2 and 3. So number first type is the hyperplastic polyp. Then the second one is the inflammatory polyp, and we have the third one, that are the hematomatous polyps. Clear? So these are the three types of the non-neoplastic polyps. Now here, this is your hematomatous polyps. These hematomatous polyps, they are further divided into three types. First is the juvenile polyp. Second one is the retention polyp, and third one is the Peutz-Jeghers syndrome. Don't worry that what are their these polyps, what types of polyps they are. We will be discussing every polyp in detail, but just I am telling you the classification right now. Clear? Now we have the neoplastic polyps. Basically these polyps, they are the adenomas, and that's why they are also called as the adenomatous polyps. Now these adenomas or adenomatous polyps, they are further divided into, you can say, four types mainly. First one is the tubular adenoma. Second one is the villus adenoma. Third one is the tubulovillus adenoma. And the fourth one is the sessile serrated adenoma. Is that clear? So this is the overall the classification. Means very easy way to remember anything is that first of all you have to know that what is the classification, what is the broad classification. Then you will be easily remembering one by one that in which type, what type occur, it means which one is the neoplastic, which one is the non-neoplastic. It will be very easy to remember. So I am just giving you a quick revision. Polyps, intestinal polyps, they are divided into two types, the neoplastic, non-neoplastic, and the neoplastic polyps. Non-neoplastic polyps, they are further divided into the hyperplastic polyp, inflammatory polyp, and the hematomatous polyps. These hematomatous polyps, they are further divided into the three types, that are the juvenile polyps, retention polyps, and the Peutz-Jeghers syndrome. Then we have the third one, then we have the neoplastic polyps, which are means the adenomas or the adenomatous polyps, and these are further divided into the tubular, villus, tubulovillus, and the sessile serrated adenomas. Now in this lecture we are going to study the non-neoplastic polyps in detail, and the next lecture I will be telling you the neoplastic polyps later on. Clear? So now come on to this hyperplastic polyp. First of all, hyperplastic polyp, basically they are obviously the small nodular type of the polyp, and these polyps, why these polyps they basically develop? These polyps they develop when what happens that the epithelial cells, normally what happens that this is your intestinal mucosa, then we have the epithelial cells. These epithelial cells, they are continuously shedding on, means the old epithelial cells they are shed off and the new epithelial cells they come on to their place. So this is the normal mechanism that is carrying out. But why the hyperplastic polyp develop? When there is an abnormality in this mechanism, in the shedding of mechanism. What happens that when the old intestinal epithelial cells, when they are not shed and the new ones come in place of them, so the old and new cells they mixed up with each other and the number of cells they become increased. When the number of cells they are increased, obviously they will be developing a small elevation. Clear? Are you understanding my point? That the old cells they have to shed off. These are your old cells. They have to shed off, means they have to move into the lumen and they have to move out from the body. Now these are your new cells and they will come in place of these old cells. Clear? These are the new cells, these are the old cells. When they shed off the new cells, they replace them. But what happens that these old cells they are not shedding off right now. Clear? Their shedding is, they do not shed off. Now what happens that the new cells they come in place of them. And now what happens that the new cells are also present at a time and the old cells they are also present. So the number of cells they are increased. When the number of cells they are increased, obviously they will be causing a elevation, because normally these are your cells. Clear? These are your cells. But what happens when these cells they are not shed off, so the new cells they come here and they take place of them, so there will be a elevation that will develop, and this will be leading to the formation of polyp. So this is a mechanism of the hyperplastic polyp, means the number of cells they are increased. Clear? So this is your hyperplastic polyp. Now what is basically the site of the hyperplastic polyp? This hyperplastic polyp site, basically this occur in the left side of the colon, and left side of colon mainly the sigmoid colon. Clear? Left side of colon mainly the sigmoid colon. Clear? Now after that, because of the presence of the new and the old cells, this type of the polyp on the colonoscopy, or you can say on the histopathology, what you will see that there will be the serrated appearance. Serrated appearance. Now what is this serrated appearance? This is just like this appearance. You can say jaw-like appearance. Clear? Zigzag jaw-like appearance. This is your serrated appearance. Clear? So due to the presence of these new cells and the old cells, that gives the serrated appearance, and these are the hyperplastic polyp. Obviously they are not malignant. This is all about the hyperplastic polyp. Now we are moving on towards our second polyp, that is the inflammatory polyp. Now the common site for the inflammatory polyp, may I erase this so that it will be easy for you to see. Inflammatory polyp, the common site for the inflammatory polyp means most commonly they arise in the, or they form in the rectum, and mainly in the anterior rectal wall, anterior wall. One thing I forget to tell you about the hyperplastic polyp, that this polyp is one of the most common type of the polyp. Most common type of polyp is the hyperplastic polyp. Now come on to the inflammatory polyp. Now this is the side of the inflammatory polyp is the rectum, and this is mainly the anterior rectal wall. Now what is the mechanism behind this developing of the inflammatory polyp? Obviously its name is indicating that it is due to the development of inflammation. Now suppose that we have, this is your rectum, this is your anus. Clear? And we have the anorectal sphincter like this. This is your anorectal sphincter. Okay, I am making it from another marker. This is your anorectal sphincter, just suppose it. Now normally what happens whenever the feces comes, so the sphincter it relax, this sphincter become relaxed like this. This is your sphincter is relaxed, and the feces move out from here. Clear? This is your normal mechanism. But why the inflammatory polyp develops? It develops just due to any abnormality in the anorectal sphincter. Any abnormality in the anorectal sphincter, in which what happens that this anorectal sphincter, it does not relax, anorectal sphincter does not relax properly, or you can say there is impaired relaxation of the anorectal sphincter. When, for example, this is relaxed to this much extent. Clear? It is relaxed to the this much extent, it is not relaxed fully. So what happens that this is your feces that is coming. This is your feces that is coming. Now some of the feces, obviously it will pass from here because some of the sphincter is relaxed, while some part of the feces will be here, will strike here, and it will also strike to this wall. This is the anterior rectal wall. The feces will strike to this anterior rectal wall, and when this condition it is prolonged for a means it occurs for a many time, or it occurs for a long period of time. So what happens that there will be the abrasion. First abrasion will develop, inflammation will occur, ulceration will occur, and finally it will be leading to the polyp formation. So the situation, if this situation is persists for a prolonged period of time, obviously the feces is continuously it is striking towards the anterior rectal wall due to the abnormality of the sphincter, as it does not relax properly. So what happens that it will be leading to the polyp formation. Clear? This is your mechanism of the inflammatory polyp. So that's why I told you the commonly site is the rectum, and this is basically the anterior rectal wall. Clear? Now we have the basically how, if you want to see the clinical feature of this inflammatory polyp, so we have the clinical triad, that is the rectal bleeding will occur. Obviously the polyp, if it is present in this region, so whenever there will be passage of the feces and this polyp can become infected, it can bleed, so the rectal bleeding will occur. Then we have the mucosal discharge can occur, and you can see the inflammatory substance at, or you can say inflammation at, anterior rectal wall. So these are the clinical features. This is the clinical triad for this: rectal bleeding, mucosal discharge, and inflammation at the anterior rectal wall. Clear? This is your all about inflammatory polyp. Now we are moving on towards the hematomatous polyp. Now what are basically hematomas? I already told you the hematomas in our previous lecture. I told you that hematomas are the normal cells present in the normal location, but they are abnormally arranged. Means if they are the cells of the lungs, they are present, the lung cells, they are present in the lungs, they are means present in the normal location, but they are abnormally arranged. And whenever the abnormal arrangement of the cell occur, for example, this is your intestine or any mucosa, normally the cells are arranged in this condition. But in for example, if there is an abnormal arrangement of the cells, so the cell, for example, they become in a cluster form, like they become in a cluster form, and in this way the mucosa, it becomes elevated, resulting into the polyp formation. So this is the hematomatous, the reason for the hematomatous polyp. And now why this means you can say uncoordination or the hematoma occur. This occur because of the mutations, simple, because of the loss of function mutation in the tumor suppressor genes or gain of function mutation in the growth promoter genes. So this is the cause of the hematomatous polyp. I told you that the polyp may be due to the mutations, and how this occurs, this is the reason here present, I told you. Now these hematomatous polyps, I told you that they are divided into the three types, that are the juvenile, retention, and the pure Jacquard's. So juvenile polyp are basically most common polyp in children. They are most common polyps in the children, and they occur mostly less than 5 years old children. Clear? And basically there is a mutation of SMAD4 gene in this. It is not necessary to remember about the genes and all that, but if you can remember, you may, but it's not necessary. Then we have the retention polyps. These polyps are basically, they are the polyps in the adults. Clear? These are the polyps in the adults. Now we have the third one, that is the Peutz-Jeghers syndrome. Obviously they are not malignant. Then we have the Peutz-Jeghers syndrome. Now it means that this is a syndrome in which the hematomatous polyps are present. Obviously the syndrome is a collection of many diseases, so the hematomatous polyps is present in this syndrome. Now what this syndrome is basically characterized by three things. First of all, we have the GI hematomas, clear, plus mucocutaneous hyperpigmentation. Second thing, then we have the third feature, that is the family history. Family history shows that this is the autosomal dominant condition, the Peutz-Jeghers syndrome. So this is characterized by this condition. This is also associated with the other cancers, like the gynecological cancers, like the ovarian cancers, breast cancers, so lung cancers, testicular cancers, they are associated with these cancers also. So the GI hematomas are present in this syndrome, that's why it is present, and that's why it is a type of, you can say, hematomatous polyp. Then The mucocutaneous hyperpigmentation basically occurs of the you can say buccal mucosa, your fingers, palm of the hands, your genitalia. So they are become hyperpigmented. Now this hyperpigmentation, it also occurs in the freckles. What are freckles? Basically the freckles are those that are develop the spots or hyperpigmentation that develop due to the sunlight. So they are also similar to this, but the difference is that the Peutz-Jeghers syndrome, the hyperpigmentation also occur in the buccal mucosa, while in the freckles the hyperpigmentation does not occur in the buccal mucosa. So whenever the hyperpigmentation in the buccal mucosa is present, it means it is Peutz-Jeghers syndrome. Plus the hematomatous polyp you will also see, and the family history, the patient will be complaining of that the same complaint was also to his parents or whatever the family is. So this is about the Peutz-Jeghers syndrome. Now this is all about your non-neoplastic polyp, in which we studied about the hyperplastic polyp, the inflammatory polyp and the hematomatous polyps in detail, in which we study juvenile retention and Peutz-Jeghers syndrome. Clear? So this is all about, and in our next lecture I will be telling you about the neoplastic polyps in detail. So thank you so much. If you have any query, any confusion, you can ask in the comment section. Thank you so much. Allah Hafiz.